Okay, so again, welcome everybody to International Admission's very first webinar geared for students who haven't arrived to MCPHS yet, or maybe who are in their first semester and want to learn more about research assistantships and internships at our university. My name is Lauren. I'm from International Admissions, and I work with all international students who live in the US, as well as those who live in Latin America. So that being said, I'm going to kick this off. Again, you can put all your questions in the Q&A and we will answer as we go. And the topic that we will be talking about today is how to find internships and research opportunities presented by our lovely international student workers that are here with us today. To kick it off, Ashna, could you unmute and introduce yourself and take it away?
Thank you, Lauren. Just making sure, can everyone hear me? Perfect. Hi, everyone. My name is Ashna. I am a fourth-year medical and molecular biology student. I am from India. The languages I speak are Gujarati, Kutchi, Marathi, Hindi, English, and I've been learning Spanish and French. So that's always interesting. My role and the internship that I will be mainly focusing on is my internship as a clinical research intern at Massachusetts General Hospital in their Center for Women's Mental Health. So Mass General Hospital is one of the biggest hospitals in Boston. It is a consortium of 6 to 7 hospitals that fall under the same network. And I had the opportunity and the privilege to work with one of their women's mental health clinics and work on some amazing research projects that I will be talking about. So get excited and please let me know if you have any questions.
Awesome. Thanks, Ashna. Oh, sorry.
Can you go to the next one?
Yes. There you go.
So the research that I primarily did was focused on the National Pregnancy Registry. So I know how important it is for international students to find research projects and find opportunities that align with their passions. And this project was very, very special to me because I want to become a psychiatrist in the future, go the whole med school route, and I want to focus on women's mental health. So finding this opportunity was just pure hard work and luck, and I just honestly lucked out. So the kind of research I focused on was I was involved with a research project that did screening and treatment enhancement for postpartum depression within the hospital system. So we took patients from everywhere in the hospital system and found how to better the screening for postpartum depression. Along with just working on the research projects, the internship also gave me opportunities to explore my other hobbies, one of which is social media marketing and digital marketing. So I was given the opportunity to create blog posts for the Center for Women's Mental Health website. You can see one of my blog posts that I created with researcher there. She's amazing. She's been a psychiatrist for over 20 years now. So it was a huge privilege for me to be involved in her project. And I also created social media content for the Center's Psychology Academy. I think I do have a poster on the next slide for you guys to see what I worked on. But this is what I talk about when I say that find a project that aligns with your passion. So this is something that you will want to wake up and go and do every day and will just brighten up your resume. Can I go on the next slide? Yes. So this was the poster I made. It was so much fun working on this. I learned a lot of digital marketing skills. I learned a lot of new techniques on Canva, which was super fun. So now I'm going to focus a little bit more about how you are going to go ahead and find those internships, how you're going to approach the whole quote unquote job search project, but focused on your internship. So one of the biggest techniques I have found really helpful is first identify your niche. So learn about what interests you and what gaps are already there within that subject or within that subject matter. Because trust me, if you think there's a gap, there's going to be 10, 15 other people that think there's a gap and they're probably doing something about it. So first find that gap and find research or any sort of research projects within that area. this can be anywhere from a quick Google search to finding like researchers in your area, trying to connect, go to Harvard. Harvard's like right next to us. Go there, go to other hospitals in the area and try to ask if they have research projects within this that you can kind of align yourself with. The next thing I did after I found my niche, which was women's mental health postpartum, was outreach. So basically, I cold called, and by cold calling, I mean create a template and just randomly call people. So I just like cold called everyone, and I just emailed saying, "Hi, my name is Ashna. I'm a third, fourth year medical molecular biology student at MCP, and I would want to know more about your research." That is how I just like cold email. I think I emailed 15 to 20 centers in Boston, and I got to hear back from 3, and I got to pick one as my internship. So it is going to be a huge downwards funnel, but I am guaranteeing you it is so worth it. The application process was pretty simple. Again, I said I sent the email, so, which is basically an inquiry to the center. They sent over a couple materials for me to review. We find out our availability. I had 3 rounds of interview, one with the HR, one with the research staff, and one with the director of the center. And honestly, they were very impressed by my knowledge about the subject because that I took classes at the university that supported my knowledge. So that's always a plus. In the end, after I got my internship, I mainly focused, I'm briefly going to touch upon the visa process. It is not for you to understand as much right now, but it is good for you to know that as an international student, when you pursue a opportunity off campus or any opportunity that aligns with your major, you have to use something called the curriculum practical training. I might be botching the name. Janice and Lauren and Paul, please correct me if I am. But that is basically a kind of an allowance that allows you to pursue opportunities while maintaining your F1 status. So I just filed for that documentation with our amazing international services team. And within a week or 2 weeks, I was able to start working at the center. So that was my journey.
Thank you so much, Ashna. That was really great to hear. And I've been looking at the chat, and a lot of people here are interested in medicine. They're interested in biology. So I want to point out that Ashna and Karbonali both are doing the bio program, which is a pre-med basically program. So their experience is particularly of interest to that group. And I really appreciate, Ashna, how you went into the detail of how many emails you had to send or outreaches, because you know, you really do have to work for these opportunities, but they're very much worth it when you do. And it's great for you to hear no's when you're young. You have plenty of time to make those yeses happen later. So thank you, Ashna. With that being said, everyone, continue putting messages in the chat, or the Q&A, I'm sorry. We will answer them as we go, and you can ask specific students here questions, and Ashna can answer questions to her, and so on and so forth. So now, Alicia, take it away.
Hello, everyone. Good morning, good evening, and good afternoon to all of you. I'm Alicia Patel. I'm a graduate student from Masters in Pharmaceutics. I'm from Ahmedabad, India. The languages that I speak are Gujarati, Hindi, and English. So my role as a research, I serve as a research student. I'm a thesis-based graduate student. So I work on a research project for MCPHS. Lauren, can you go to the next one? Currently I'm working on a research project to develop a multi-drug tablet with 3D printing technology. So as we know that hypertension patients are prescribed a lot of medications in one go by the medical practitioners, and this is the reason of poor adherence of the treatment, and the patient faces tablet burden. So here we are formulating a tablet which which would consist of multiple drugs, and we are using a novel 3D printing technology. So this would be helpful to make orally dispersible tablets. So there are a lot of 3D printing technologies available. One of them which I'm using is selective laser sintering. Lauren, can you just click the video for me? So this is one of the video that I have for laser sintering. So in this process, different layers of our API and excipients would be layered one by layer, and the laser on the top of the printer would sinter those particles. This will allow the layer by layer formation of the tablet. So this is my research project, which I'm currently working into. Uh, Initially, if you are a thesis-based student at MCPHS, what you'll be asked to do is you'll be asked to take lab rotations under different professors. So was I. So I took 3 lab rotations under different professors. So all you have to approach is just send emails or just stop by their office whenever the professor is free. He'll send you the meeting link. He'll just ask you on your basic knowledge from your undergraduate studies. He'll just check on your knowledge, and then he'll start lab rotations under him. You'll get to learn through that professor, and also the PhD as well as master student who are pursuing their research under that specific professor. So after you are done with 3 lab rotations, you can select like what interests you, which professor's research would interest you, and you can approach him like, I want to be your graduate student. The professor might be free because he's not working with too many students, or he's working with too many students. Based upon that, he'll select you as your student. And I got into one of the interviews with my advisor. So after that, he was ready to work on small molecule formulation, which is his basic research interest as well as mine. So in a thesis-based project, you will be asked to work. You're asked to get done with your courses, as well as you need to submit a research project in order to graduate. While you're working under a thesis, it is also important for you to enhance your presentation skills, because you're going to propose your thesis, as well as you're going to defend your thesis in front of the committee which you have selected, consisting of different professors, as well as you're going to defend your thesis among the panel of all the professors of the pharmaceutical sciences department. So every semester we have a graduate seminar. This is one of the picture of mine in a graduate seminar. So you'll present different research papers. You can also present your own research work amongst your department. So in pharmaceutical sciences, what we have done this semester is we have compiled all the 3 domains, that is pharmaceutics, pharmacology, and medicinal chemistry. So I'm a student of pharmaceutics. I'm presenting a research paper, and some or the other professor or the students from pharmacology is thinking along different lines. He'll share his idea with me. He'll ask me different questions. Yeah. So that I can also learn from him and also think along the same lines, because as we go out in industries, it's not just going to be pharmaceutics. It's gonna be different people approaching you with different knowledge. So this is really helpful for us. Moreover, when you're working in a thesis-based program, your research is fully funded by the university, as well as you get different research funds. I'm working as a teaching assistant right now. I've been working since a year for different family courses. So I've worked as a teaching assistant for pharmaceutical dosage forms, pharmaceutical calculations, and chemical principles. So when you work as a teaching assistant, of course, you get paid, as well as you also get partial tuition waivers. So it's not a definite thing that you will always get tuition waivers, because there are limited number of scholarships for the graduate studies. But it depends on your resume, as well as the funds that are available at the time with the department. Uh, Moreover, it's all up to you that how many hours you work for your research project. It's a discussion between you and your advisor. What I like to do is I work from Monday to Friday upon my schedule for like 4 to 5 hours. So this was my journey at MCPHS. I'm still working with my research project. Please let me know if you have any questions. Feel free to ask and feel free to contact me. That's all. Thank you.
Thank you so much, Alicia. I'm so glad that you were able to join us today, because I know we have a lot of students on this call right now who are interested in the School of Pharmacy for many different programs. So Alicia, if you could take a look at the Q&A and just start chatting with some of the people who are asking questions about pharmacy and School of Pharmacy, that would be great. But what I'd like to highlight about Alicia is, one, her project is just probably one of the coolest things I've heard since I started at MCPHS. I love that she's able to mix her love of pharmacy and modern technology by using the novel 3D printers, which we have on our campus. Which brings me to another great point, is that we have some of the most state-of-the-art equipment on our campus. Some pieces which no other universities actually have. So this really is a special place to be if you are interested in learning hands-on work and about research opportunities. So with that, we're going to move on to our next student. Hani, could you please take it away?
Hi everyone, nice to meet you all. I'm in my 4th year, a health psychology student, final one. I am from Venezuela and also from Colombia. The language that I speak is Spanish and of course English. The role that I have right now is the adaptive sport intern at Francisca Children's Hospital. Thank you. Okay, so this is a hospital that is not like a common one. This is just for children who has special needs. For example, a different disease has Down syndrome, autism, and the goal of this program is to adapt some sport, has basketball, soccer, hockey team for children who have disabilities. So I am working right now Monday and Tuesday, going to the different activities, but also working at the office. What I do is like helping with the check-in, check-out, helping the children, get hands experience with working with them, get a better understanding what is the child population that we work and the various departments that Franciscan Children's Hospital has. Run the different activities because they have like different seasons. For example, right now we have an extra activity and also the hockey team for children who have Down syndrome at this moment. But next month we are gonna have a basketball team and also like a dance program for them. At the same time, I help with the equipment inventory and also track like have a track for everything that is like happening with the volunteers, because each children have like a one-on-one volunteer. So yeah, most of them is like that kind of experience. And it is related with my majors because right now I'm a health psychologist. So this opportunity I found through my field and placement class. That is a class that you have in your last year. You have to do usually 80 hours or 90 hours are there on the semester. Then you have to work like 9 hours per week, and it's with a like the how can I call this opportunities with the CPT.
And
CPT is like permission.
Hani, I'm sorry, I want to interrupt for a second because what I want to point out is Hani just mentioned the field and placement course. So that's built into her program already. So she's required to get experience as part of her program, which isn't the case for all universities and all programs. So I just wanted to highlight that piece before you moved on, Hani, because I think that is really cool for your program.
Yeah, some programs have that. Actually, I think most of them, they don't have the field and placement class. But yeah, health psychology have that opportunity. So you can do it through the CPT process. That is like a visa process, but it's super easy actually. It's just like you ask for the immigration office and they send you all the documents. You just have to get like the letter from the hospital and submit it. That's it. Yeah. So it's actually a really easy process that is, it just takes like a week. You just have to find the opportunity. Can you go to coordinate the slide? Actually, that is that part. Okay. Oh, I already say the responsibilities. So here to highlight is like maintaining paperwork from the sport participations and the programs. I actually have to do some cards for each volunteer and then add like how the disease, how to work with the children, because each children have like different like kind of disabilities. So you have to know how to like interact with them, because it's a little bit hard in that part. Also provide support during every single activity, ensure that the staff have the necessary schedule. Also like everyone is working with one child, because most of them like you can do like a general activity for them, like for example soccer, everyone playing, but they need a special actually treatment, well that you have to work one-on-one. Yeah. And okay, so this part is the CPT authorization that I was talking about. So usually you just start working on that over the summer, and your professor from the classroom freedom placement is gonna send you like an email saying like, okay, you have to start looking for a placement for next year so you can complete your hours, get the work experience, and you start searching the placements, and then you should have like 4 places, and like then you have interviews and everything. And how I found this opportunity was actually through the MCPHS Blackboard. They have, I remember a flyer that say, oh, Francisca Chine Hospital is looking for volunteers at the adaptive sport department. So then I emailed Paul, who is actually my boss right now, and he sent me an email back super quick. I thought he was not gonna answer me, but he answered. And he scheduled an interview. I sent my resume, cover letter. I have the interview, and it was actually pretty easy. It just like, it was the interview, most of that part. And then it was like, okay, so now is the international part, because I need to have like the permissions and everything so can start at the beginning of the semester. And then I just got the letter. You have to get like a confirmation letter from the placement and just submit it to the immigration office. And then you through this website that I am showing here, you just submit the paper document that is like I-20s. Yeah, it's like super like easy actually. In the part, usually I submit like the run of applications, 3 or more, secure your freedom placement, and then I contact my immigration that I was doing and submit my application, and that's it. And now my program is from September 5 to December 8, completing 8 hours each week actually. Yeah, I think I already mentioned that part.
Yeah. Great. Thank you so much, Hani. So I hope that was illuminating for some of you who might not be here for bio or for the pharmacy programs. And also this again, as Hani mentioned, it was her boss who she actually had to interview with, or she already had a connection before that person became her boss. So one of the things that I really like to point out here is to network. We give you a lot of opportunities literally from the day one before you even start classes. So for example, this year we had our international student reception on both campuses, which a lot of these panelists here actually attended and helped with. And during that time, we were able to engage with so many students and learn so much about them that some of those students actually found jobs that night just from the way they were able to present and mingle with people. It doesn't always happen like that, but I really want to impress upon the part that the networking is your responsibility, and it's one of your biggest assets whenever you are a student here at MCPHS.
Yeah, and also I want to highlight that if you're worried about like the interview part and sometimes the resume because you have to submit like the placement, it's like really easy because we have a center at MCPHS that they review everything. And actually since since the first week, I remember from my first year, I start working on my resume. I have a seminar class that usually you work with the professor, and then you have to like submit it every single year and like be in everything so that you can have your resume ready for the day that you're gonna find your field and placement. And like there is a lot of like on Blackboard side, for example, I found this opportunity because of a flyer that my director, Dr. Spencer, she posted, and I just was like, oh, this sounds like great, let's search it. It not necessarily has to be like a website from Google. Yeah, you just can find it on Blackboard site.
Yeah, thank you for mentioning that. So like she said, we have our Career Services Center, which can really help you develop your materials. And I always tell students that in your first month of MCPHS, you should be there. You should be making friends in that office as soon as possible, because they're the ones who have done this with thousands of students at this point. So thank you, Hani, very much. Now, last and not least, we are moving over to Kurbanali. So Kurbanali, can you unmute and join us, please?
Hello, guys. Can you hear me properly? Great. My name is Kurbanali, and I'm second year medical and molecular biology student here in Massachusetts College of Pharmacy and Health Sciences University. And I'm originally from Tajikistan, a very small country in the Central Asia. And the language that I speak are English, Russian, Turkish, and Tajik Persian. It's pretty like different languages because throughout my life, I lived in many countries. So I kind of lived my life in journey. And my role for my work that I'm doing is a research intern in Harvard Medical School and Boston Children's Hospital, which are just 2 minutes walk from our university. And not to mention that Boston Children's Hospital is the #1 children's hospital in the entire United States. And I think it was nominated 9 times in a row, starting from 2013 and 14, and 9 times in a row being the best children's hospital. And why I choose exactly this hospital? Firstly, because I personally want to become a pediatric neurosurgeon. And the lab that I'm working, if we could move to the next slide. Thank you. So the lab that I'm working in, it's called Tanks Lab, which is in the collaboration between Harvard Medical School and the Boston Children's Hospital, as I said. And our goal is pretty clear on that. We are really dedicated to, advanced precision medicine for brain disorder using genome editing human stem cell. Pretty fancy name, I know, guys. And most of you right now in the high school and thinking what this guy is even talking about. But don't worry about this. Once you start your college, when you start your first year, maybe in MCPHS or any other place, you start taking the lab classes, which are in biology and chemistry. And actually the first year really helped me here in MCPHS. Sorry for that. Helped me into like working in the lab, working with partners. They make us to work in the groups and to kind of getting comfortable inside these labs and knowing that if you actually really interested working in the lab with big professors, for example, that I'm working with Professor Shin, which is also, I think, professor in neurosurgery, department in Harvard University. So my job in the lab is gel electrophoresis, like the method used to separate the analyzed DNA, RNA, and protein based on the size and their charge. Also, I do buffer preparation, ensuring the correct pH and ionic conditions for optimal electrophoresis, PCR, and agarogel electrophoresis. Also, I do DNA extraction from cell pellets, which is retrieving genetic material from condensed cell masses from analysis. Also, I don't want to really get you guys bored about how these words are like maybe seems really complicated for many people, including me. If like 1 year ago, some guy, in other side of the world say, okay, I'm doing immunostaining or immunoblotting. And I'm like, what is that even talking about? So basically the biggest goal we want to reach out is actually the cancer. We want to study first how the people start like to getting the cancer, the pre-stages, because as we mentioned, the Boston Children's Hospital being one of the #1, we basically created several techniques to prevent from kids especially getting the cancer, or in the future we're planning to kind of eliminate every kind of a children to make precision medicine, kind of creating a surgery method that could cure many cancers that are right now are impossible. And our lab is really moving toward pushing the boundaries in medicine worldwide. We have in our lab is very diverse. We have people from all over the world, and everyone came to this lab with one big goal of basically helping the medicine and pushing the boundaries. Can we go to the next slide? So as I already heard, many people already talk about how to find the internship and what are some good strategies to look. And as already Ashna, my colleague, mentioned that self-assessment, right? Finding your niche is very crucial, because if you don't know firstly what you want to do, it's gonna like kind of confuse you. If you take your class in the first year of the college, let's say you take the chemistry and the biology, and find what is your interest, what do you enjoy about these labs, and then the second one would utilize campus resources. Here in MCPHS University, we have campus life, we have case, and all this. There is like professors, we have academic advisors. For example, you can take appointments individually and go and say, hey, I'm really interested in the doing internship. How can I find? Where can I find? And most of the time, sometimes they refer to us, or many times they send us email in the school. They are, hey, there is in Beth Israel or Boston Children's or Mass General Hospital, there is an opportunity for volunteering, doing research. And I heard many of my friends, and including me, really got advantage over this, and land in a dream internship that like I was dreaming about. And third thing I would mention is online platforms, which I personally like use the most is LinkedIn. Building your resume from the beginning. Every single activity you guys do, just put it in your resume, put it in your LinkedIn, and show the potential PAs, which is we call the advisors for the lab, that you are actually really dedicated to do like being worth it, having a place in the lab, because most of the time they also want a person who is really dedicated to the work they want to do and really bringing some innovations, from themselves. And the fourth point I would go is like staying organized, because many people like stay organized when they are doing the research, but being organized in the way you have to keep with your classes, like making sure that you're getting like a good grades that you want, because grades are the most important thing, and this is one of the goals that you are here in the school. And you need to understand that the research is your secondary. This is additional something. For example, for me, for going to medical school, maybe everyone will get about 3.5, 3.6, and this is something like additional that strengthens your application to the medical school or the master program or any PhD you want to go to. And be persistent, of course. It's the most, I think, important thing. I personally got rejected for more than 8-9 times. I sent the email to one of the lab, and then after 2 hours, like something, he sent me the rejection. I'm sorry, we cannot have you in the lab because we don't have space. And after several attempts, like going to this professor, that professor, and I got actually in the lab that was like my dream for like entire my life, being, you know, in the best children's hospital in the United States. And of course, prepare for the interviews, prepare like if you get that internship, prepare, know that what your goals are. Sometimes, for example, they ask me, where do you see yourself in 10 years? And I told them what is my goals and where I want to be. And they seem to be like, really liked it. And here I'm in right now doing my internship there, and I'm doing several volunteering works in different hospitals. And also I got my EMT license. So we're kind of grasping in every single opportunity that comes, and don't wait for the opportunities, but rather go for them. Thank you so much.
Thank you so much, Kurbanali. That was really great. And I think a lot of the students here that are interested in pre-med or bio will definitely be interested to learn about everything that you just mentioned, and excited about the opportunities that you took. And the biggest takeaway from Kurbanali's presentation that I want to mention is this is a guy who didn't accept no, and he didn't see an end that he could not reach. So any possible opportunity that came up, this guy took it. He also recently went to the UN to present in New York City. That was something that he sought out and applied for and was approved. So I think the biggest takeaway that you should get from his presentation is to try, and also use the resources at MCPHS to help you. So for instance, Hani had mentioned our Career Services Center that can help you with preparing your documents. Absolutely, that's huge. That is something that you should be doing in your first month at MCPHS, like I mentioned, so that when you find the opportunities that Kurbanali, Alicia, Ashna, and Hani have found, you are then ready to apply immediately, because they are getting a lot of applications. So the sooner you apply, the sooner your name gets in front of somebody, the more of a chance you have for working with them. Okay. So that being said, it is now 7:44. We can transition over to the Q&A. I know a lot of you have had your questions answered by our student workers that have joined us, our panelists, and also Janice and Paul. So thank you everybody for doing that. What I would like to do now is all of our panelists, if you have a question, see a question in the chat that you specifically want answered, let's go ahead, bring it up to the whole group, and we can answer it on the spot. Okay. So one of the first questions that I wanted to talk about, I saw, Ashna, that you had written back, and I believe it was about CPT. Do you remember the name of that student so I can find it?
I think it was by Jiwon Lee. They sent a question about is how the volunteering and the CPT, which I think is great for us to answer.
Okay, I found it. Yes. So the question was, I heard that in order to conduct, oh, I can stop my sharing right now. I heard that in order to conduct research, you would need to make a volunteer opportunity if you wanted to do the research. Otherwise, you would have to use OPT. Could you share how you overcame that barrier? So Ashna, I do, if you would not mind sharing your experience, and then I can help, answer any gaps that might be there.
Thank you. I'd definitely love to do that. So basically, if you are working or finding opportunities that are under 20 hours, you do not need to touch your OPT at all. There's another set of practical training that we can use. Hani talked about that. It's called the Curriculum Practical Training, or CPT, which allows you to work under 20 hours off campus. And there are a certain set of guidelines that you have to adhere to when you're working off campus. So CPT is used for opportunities where your major is directly aligned to the opportunity. If you are going and finding a job as a patient greeter at a hospital, or are you finding a volunteering opportunity where you are just standing at a door and guiding patients or guiding people to specific locations, that does not require specific major-based knowledge, that means that you can do it as a volunteering opportunity. However, any job that would require you to gain additional knowledge or gain major-based knowledge would require you to use your CPT. OPT comes in play if you use, OPT gets used when you use your CPT for more than a year on a stretch. If you are not doing that, if you are using your CPT for a semester under 20 hours per week, you should be completely fine. Is there anything else to add, Lauren?
I think you did a really great job there. And I think also what I would mention is it's a balance, right? So if you find a really great opportunity that would require you to use your OPT and you don't think you want to eat into your OPT, which is what you use at the end of your graduation time, because that is limited, you don't have to. So Kurbanali is a good example of this again. He mentioned that he is now certified in doing EMT work, but he is an international student. So now if he wanted to work as an EMT, say during the summers, and he would want to work more than 20 hours a week, he would be using his OPT. So he would have to choose whether or not it makes sense for him to use his OPT during the summer before he graduates, and then just limit the amount of OPT he would have after graduating. One thing to mention is the amount of OPT that you get after you graduate is based on your program being STEM or not STEM designated. The school doesn't designate these, it's the government that controls it. So biology, for instance, is a STEM program, so you have a longer eligibility for OPT after you graduate, whereas if you do the pre-med program, you would have 1 year of OPT. So that's something to take into consideration whenever you're deciding, especially as an undergrad and you're interested in medicine. It would make sense to talk with your counselor and figure out which program makes the most sense for you based on the goals that you think you have right now. And then after like a year or two in the program, reevaluate and make sure that those goals are the same. Ashna is a great example of this. She started out as pre-med, right, Ashna? And then you moved to bio. And part of the reason was because of the extended work opportunities she would have in OPT. Okay, so we do have another question in the open chat section at 7:44. I hope I'm pronouncing your name wrong. It looks like Sain Seong. What is the specific work in the Boston's Children's Hospital? So I'll give you a brief answer, but then if Kurbanali and Ashna, I think you both are connected to that hospital. Ashna, are you connected to Boston Children's Hospital?
No, Mass General
Mass
and
General.
Beth Israel, but I
Okay.
can definitely talk about it.
Excellent. Okay, cool. So really the kind of work that is available to students, whether it's as an internship or a part-time job or an assistantship, that's really going to be up to the department that you're applying for and your skill set. So if you went, so for instance, Ashna right now also just got a part-time job as an operating room attendant. Super excited for her. And she'll be starting that here soon, but at a different hospital. Those kind of roles still exist at Boston's Children's Hospital. However, that's a specific department. That's one sliver of the entire pie. So you could be doing work in the pharmacy department. You could be doing work as an operating room attendant. You could be working at reception or something like that. It just really depends kind of the area that you go into and your studies. So Ashna and Kurbanali, I know if you guys could just quickly answer that too.
Kurbanali, do you want to take it first and then I can?
Sure. Well, as Lauren already mentioned about this, there is like variety opportunities. So I will talk right now about my own experience. So basically what I'm doing is I'm being assistant for the professors that are doing the lab project. So basically I help them. And as I already mentioned, I'm doing gel electrophoresis, for example. This is some small part of the lab that, me, for example, a student in bio or pre-med or any other like subjects in MCPHS in the second year can perform. And yeah, basically that. And also Lauren kind of like summed it up and saying that there is many opportunities. My friends, for example, in Boston Children's Hospital doing volunteering works, which looks really nice in your resume, because one part of like applying to medical schools here in United States is having volunteering works, showing that you are like really dedicated to work, for people. That's the word I would say.
Okay, I can talk more on that. Thank you, Kurbanali. That was a great start. So basically, when we talk about volunteering opportunities, something you can do at Boston Children's or any hospital without you requiring specific knowledge, just to, like if you want to start or if you just want to see what hospitals in US are like, is something called a patient greeter or a patient guider or a patient floater. These people are people from all backgrounds that are just volunteering at a hospital because they want the help. This does not require any knowledge about biology, about medicine. You are just there to go help patients, give them a little bit of directions to where they want to go. You just talk to them when they're in the waiting room, have a chat, give them books. If there's babies, you give them coloring books. So it's basically some work that anyone can do without any background. If you want to go specific into certain research opportunities or internship opportunities at Boston Children's, I know they do amazing work with patient care associates. So patient care associates are people that are like just 2-3 steps above a patient greeter. They are focused towards the individual patient's care. They sit with the patient in a room, they talk to them, they take their vitals, they learn more about the whole treatment plan. And for that, you require a certain set of skills. So either you need to have a CPR, basic life saving certification, and there's other set of skills per hospital that are different. Boston Children's, you will be working within pediatrics the most, which is one of the most difficult specialties once you start like applying to pediatric neurology, cardiology. So they have more requirements. In Beth Israel, I will be starting work as an OR attendant, which is an operating room attendant. I will be working towards like operating room turnovers, patient transport, blood sample transport, taking vitals and stuff like that. That is one opportunity that is also available in Boston Children's. So these kind of opportunities are really, really beneficial when you're just starting out or want to explore a career in medicine. Another thing that I've seen is medical assistants and certified nursing assistants. These are students that work towards getting certified as a medical assistant, and they practice under a physician in helping build a basic treatment plan for the patient, like get the prognosis, get vitals, deliver tests, take lab samples, stuff like that. So for that, again, those are higher acquired skills. You need certifications for that. So this is kind of a trajectory you can take while volunteering or working at a hospital based on all these different levels.
Thank you so much, both of you. That was super helpful. And I know that you all are still in the chat and answering questions. So I thank you for that, because I know we aren't going to be able to answer all the questions live. So all of our panelists are diligently plugging away, trying to answer all of your questions. But if you don't get your questions answered, I will send our contact information at the end of this, and you can copy and paste it and save it. And for our student panelists, it is up to them whether they want to share their personal MCPHS email. But if you would like to connect with them, you can always just email me directly and I can connect you with them, just so everybody knows at the end of this. One thing that I do want to answer is we had a student asking about the hostels or the room and board situation at MCPHS. So is it safe? Is it safe for men? Is it safe for women? The answer is yes. We have specific floors that are gender specific at MCPHS, and your badge would let you up to that specific floor. So you can choose to live in a co-ed hallway. You can choose to live in an all-female hallway. The rates of crime on MCPHS campus, I don't know the statistics, but they're very low. I haven't had any of my students go into the dorms and then be concerned about them or come talk to me afterwards and share that they don't feel safe. So I think you would be very happy to find the living spaces in MCPHS are safe. There's a security desk as you walk in through the door that you have to scan your badge. So only MCPHS employees or students can join both the campus, but also like I can't even get into the dorms with my badge because I'm an employee. Only students who are assigned rooms in that building can get into that building. And it depends what kind of dorm you get as to whether or not you'll have your own bathroom and your own kitchen, or if you'll have like a shared room and then a communal kitchen and bathroom. Or we have like suites where you have a few roommates and then you share 2 bathrooms in your suite and you have a shared kitchen as well. So there are a few different living options on the MCPH campus. Okay, and that being said, I think we have time for one more question. I can open that up for our panelists. Do you see a question that you really want to take a moment to answer before we go? Okay.
I could just like talk a little bit in the question that's been asked about what are some really important things when you're applying to internship, the institutions take into consideration is that the first thing, it would be relevant academic background. So if you are studying in bio major or pre-med, it would be really, it's better for you if you go to some bio lab that are doing, based on the biology or like something genetics close to that. It will be really good. And second thing would be if you have done, previous research, internship experience, or if you are already a student in the second year, you already have like this kind of background inside the lab, as we mentioned. The technical skills would be good. Some recommendations when you are in the first year, make sure that you are like knowing with students, going to the lectures like all the time, and letting the professor know that you are, these students who are really interested into the program that you are. So like when you are asking for recommendation, they're gonna, recognize you and write you a good recommendation letter. So, the employees take that really into consideration. For example, for me, I had to request 2 recommendation letters from both of my professors, and I never saw the recommendation, but it seems to be nice. And yeah, that's some really important things.
Yeah, I also want to add something. The recommendations letters are really important. So since the first semester, try to have like a professor, like start asking questions in class, send emails, get a relationship with one professor, or also your like program director. Like try to go to some meetings that they have. For example, they usually have like seminar classes, participating with your professor, because at the end you need to have like at least 2 or 3 recommendations letter. Actually, yesterday I request one. I have like a meeting with my program director, and it was like 2 hours meeting for one recommendation letter for my graduate school. So it's a little bit hard to get sometimes then, but for that reason, in the first semester, you need to start building the relationship, like at least with 3 professors or 2. Yeah.
Thank you, Karbanali and Hani, on that. That's really great. I do want to bring up one thing that came up in the chat. Someone is mentioning that they have a career and they don't want to put that at risk, and they want to make sure if they choose the non-thesis master's program at MCPHS that they'll be able to settle down in their nation or benefit them in the US. So essentially a guarantee of a job is what it sounds like. I do want to reiterate that we cannot guarantee you internships, assistantships, jobs, but what you can see is that our students who are trying and who are putting in the effort and the work are getting them. And you can hear this not only because they're not just talking about their experiences, if you've heard, but they've also been sharing their friends' experiences. And I think one thing that's really special and unique about this campus is that MCPHS, every single student is like-minded in that they are all healthcare oriented. They all want to go down the track of helping people and being the best medical practitioners that they can. And so that's another reason why I think a lot of our students do end up with great internships, jobs, and assistantships during and after the time they graduate. But of course, and maybe the students here can speak to that, like Alicia, you had to work really hard to get your assistantship position. So maybe you can speak to that and just kind of explain, like, no, you can't be guaranteed, but your experience and your friends' experiences, as long as you're performing well and you're putting in the effort, you have a chance, a really good chance.
Yeah, That's true. Even I answered some of the questions about the non-thesis masters. There was a question that if someone wants to do PhD after non-thesis, that's a requirement for PhD programs that you should have done a thesis-based masters. Except from the research opportunities, if you wanna do PhDs in your further education, you should opt a thesis-based program. It's a great opportunity to work under some professors having that knowledge about a research project, and this would help you finding a full-time job as well. It looks very nice on your resume that you have already worked in the US upon a project where you are designing experiments. You're facing some of the issues, resolving those issues, and then moving further with that research, as that is what you're going to do in your full-time job. And one more thing I would like to highlight, there was a question about the scholarship. I don't think there are any graduate level scholarships which are being definitely given to the students. It only depends from student to student, that based upon your resume as well as how you are doing well at MCPHS. If you are doing a thesis based program, then in your second year when you're actually starting your thesis, so that time it totally depends on the department, and as well as your grade, your GPA that you have, it should be above 3.2. If that's the case, then depending upon the funds, those scholarships or the partial tuition waivers are given to the student. But again, having said that, it depends differs from every student to student.
Awesome. Thank you for that, Alicia. I'm really glad you brought that up. Just for the sake of time, I'm sharing this slide again so that you all can have our contact information, and you are more than welcome to please email us and reach out. We will connect you either with the panelist here that you want to speak to, if that is something you're interested in, or we can also connect you. I know we had a dental health student in here and a few others that we didn't get to answer. We can still connect you with students who are interested or studying those programs, and with the counselor that you need to speak with. But I want to make sure I give you this contact information. It is 8:03, so I'm just going to add on to Alicia's answer, and then Hani, I think you wanted to answer somebody's question about about letters of recommendation for students. So I'll give you a moment to do that. But I just want to go off of what Alicia said, that yes, master's programs, we do not offer scholarships for master's programs at admission. So the way of getting any kind of help is how Alicia mentioned already. And for undergraduate programs, we do have scholarships, and they are completely based on your merit. So we'll evaluate your GPA, your letters of recommendation, and your experience, and then you'll be assigned a scholarship at the same time that you apply. You do not have to apply for a scholarship. You will automatically be reviewed for it. And then Hani, if you could wrap that question up in about 30 seconds.
Yeah, the recommendations letters, so they can be from professors. Usually if you have a work at the school, for example, I work for IBC, I can request a recommendation letter to Lauren or any of them. Or also outside, you can also, if in your country you did like an internship or you was working there, you can also get a recommendation letter from there, and they will be like, it has to be in English, but it will work perfectly. You just need like a recommendation letter for an employment part, internships, or academics. Yeah, can be any of them.
Awesome, thank you, Hani.
So like also there is like specifications, like no all of some of them just request, for example, for the academic part, and others they request for employments. Yeah, it depends of universities or the internships part.
Awesome, thank you. I think that's really helpful information for everyone to know. That being said, everybody, I want to thank you so much for coming and joining us today. I really want to give a big thank you to our panelists. They worked really hard on condensing their many, many, many hours of experience into about 8 minutes. So thank you for all your work. Thank you for answering these students' questions. For all of you on the call, if you have questions, please do email us. We are very responsive. We will get you in touch with your correct counselor pretty quickly. And it is only the end of September right now. So some programs are still open for applying in January, only some. And then others, we are definitely open and accepting fall 24 applications. So definitely reach out with your questions and have a really great day. Thank you, everybody. Panelists, you can also go off mute and say goodbye.
Thank
Bye.
you for coming, guys.
Bye.
Bye-bye.
Thank you for coming.
Bye, guys. Thank you for joining.